All right, so welcome in once again. Today is our session 2 of the childbearing education workshop hosted by me, Ellen Branch. Today we're going to be talking about the hormones and physiology of childbirth. So when we think about hormones and physiology, basically that just is how our bodies are reacting to labor and what we can do to support ourselves. And for legal disclosure, the information in this publication is not to be used or construed as medical advice. It is not intended to replace the care of a licensed healthcare provider. The information shared in this publication is created to inform families and birthing people about common knowledge regarding pregnancy, hormones, labor, delivery, and postpartum healing. All information that was not written by the author has been credited, and the publisher, author, illustrator, editor, and Simply Ellen Holistic Services are not liable for any loss, damage, or injury incurred during or directly or indirectly as a result of any information shared in this publication. Okay, so let's talk about hormones. So we want you to be able to understand the role hormones play in stimulating labor, understand the hormones that are at play in prolonging labor, and then assess potential remedies to stimulate labor naturally. So let's dive into the first one. Labor stimulators. So when we think about the question that was asked before around what hormones we want to allow into our body, these are the hormones that we want to allow them to do their job. We want to allow oxytocin and we want to allow endorphins to support us as we go through the process of labor and delivery. What is oxytocin? So oxytocin is the hormone that is responsible for uterine contractions, and it is also responsible for things like social bonding, falling in love. It's like the love hormone, so it helps with reproduction. It makes us feel like we want to bond with someone, that we want to be physical with them. It stimulates our body during childbirth and even after childbirth. So when we think about oxytocin, it's released and produced in our hypothalamus, which is in our brain, and also in our posterior pituitary gland. So all of that is happening in our brain, and it's a nerve protein. So when we think about it like that in comparison to the other hormones that we talked about prior to, those are ones that are produced in like your endocrine glands. Those are ones that are produced in other parts of your body, but this one is very much tied to the mental aspect of labor and the mental aspect of bonding with your people who helped you build a baby, bonding with your family, bonding with your own child, and then the process of labor. So it's an amazing thing when you think about the role oxytocin plays, because it was there when before you knew that you were gonna, be pregnant. It was there when you conceived. It was there while you're pregnant. When you laugh, when you hug someone that you care about, when you have a conversation with someone, it doesn't even have to be a family member. It could just be a really good conversation. Oxytocin is flowing. It's that it's the hormone that's responsible for people being like, dang, that was like, I really enjoyed talking to them. That's oxytocin at play. So when we think about it in terms of labor, oxytocin contracts the uterus and promotes the progress of labor. So when we start to say contractions, when we say that, a lot of times people get scared because like, oh my gosh, my uterus is going to contract. Oh my goodness, it's going to be so painful. What's going to happen? How am I going to deal with this? We need to reframe that. We need to think about it from the perspective that oxytocin is providing you the opportunity to meet your baby sooner. Every time that oxytocin surges or oxytocin pulses during labor, you are getting that opportunity closer and closer and closer to meeting your baby, closer and closer to getting dilated, and closer to being finished with the first part of becoming a mom. You were pregnant and now you're going to deliver your baby. So a large oxytocin pulse occurs with the birth, and pulses continue afterwards. Okay, so we can reframe the word contraction with pulses. We can reframe that with surges. We can call it waves. Drop in the chat which of those, if any of them, might sound a little less scary to you, so that then you might be able to start reframing how your body is responding to labor and how oxytocin is playing a role. Because when we start to mentally wrap our mind around these surges or these waves, it makes it really easy for us to be able to ride the wave and be like, ooh, okay, I feel something building. Ooh, okay, I can do this. I'm gonna ride this wave down. So this helps you, oxytocin helps prevent bleeding after baby's born. And it also ensures that you can stay warm and your baby can be warm once they're born for that skin to skin contact. Okay. So when we think about how it prevents bleeding, if you are having these surges and these waves, press down and bring your uterus closer and closer together after it's been stretched open for 9 months growing a baby, that wound where your placenta was at, and we'll talk more about the physiology and where everything is located in the next part of this presentation today. But that wound where your placenta was located is about the size of the inside, like right here, your palm. So when we think about that, we want to encourage and we want to say, okay, yes, after you have your baby, you are still going to be having those waves, those surges. And if you're delivering in a hospital, you're more than likely going to be given Pitocin, which is the artificial form of oxytocin to help shrink that uterus down and make that wound smaller and smaller and smaller. Okay. So oxytocin is big chief when it comes to labor stimulators. Okay. So when we start to think about that, what can we do to encourage the release of oxytocin throughout our labor? That might not mean that we are experiencing really strong surges or strong waves, but we're experiencing moments of laughter. We're experiencing moments where we can sing our favorite song, we can dance, and that's all going to help to stimulate more oxytocin production. Are there any questions about oxytocin before we move on to endorphins? Hold
Outside
on
of
1 second. I'm gonna pause it. 1 second. Let me pause. Okay. Okay. Not that part. Hold on 1 second. The recording. So when we think about one more thing I want to mention around oxytocin is what happens when we have oxytocin and we're not in labor yet. And this is a question that comes up oftentimes when we have discussions around oxytocin and Braxton Hicks contractions. So Braxton Hicks contractions are literally just contractions that your body does before you are ready to go into labor. So this could happen at 20 weeks, 25, 26, 30, 32, however long, whatever part you are in your pregnancy, that period of time before you are at full term, which is a 39-week mark, those would be considered Braxton Hicks contractions. Reason being is because most times the Braxton Hicks contractions are not intense and they only last maybe 15 to 30 seconds. And sometimes it's not even your whole belly that gets hard. It's maybe one side, or it's just the top, or it's the whole belly, but it just gets tight like a basketball and then it goes away. That's your body having like those warm up contractions, right? It's warming it up. It's saying, okay, oxytocin, how much of you do we need to get a good contraction going? How much do we need to ensure that we are moving baby down, but not too much to where their heart rate or mom can't tolerate it? Okay. So that's how, when we think about what happens with oxytocin before we're ready to go into labor, and if our body is naturally producing it throughout pregnancy, that's how it would show up. And sometimes we can note that maybe you have a Braxton Hicks contraction, or you have a series of those Braxton Hicks contractions after you just had a long walk, or after you got a massage, or after you went, or after you got off the phone with someone and you had a conversation with them, whether it was positive or stressful, whichever one it may be, your body is releasing that hormone to say, okay, we are in this moment and now it's over, right? So let's relax through it, and that's what the oxytocin is bringing in. And oxytocin works very well in hand with endorphins. So endorphins are great during labor and birth because they can help you take your mind off of the oxytocin that is controlling the surges of your uterus contracting down. So when we think about endorphins, think about it like the happy, euphoric, oh my goodness, everything's amazing. And you hear about this when moms say, oh, I had an orgasmic birth. Oh, I didn't even feel those contractions. It was amazing. It's because their endorphin levels were so high that as those surges came, as those waves came, their body was just like, all right, girl, we doing this. You ain't got to worry about nothing. You just sit there and keep breathing. Right. And you might feel it. It doesn't take the pain away. It doesn't take the discomfort away, but it helps you process what's going on. And it's like, okay, yes, every contraction is getting me closer to meet my baby. Yes, this is normal. This is what my body's supposed to do. I want to get up. I need to use the bathroom. Oh, I'm thirsty. That's that feeling of getting in the flow. And when you're in the flow of birth and when you're in the flow of labor, that's when you have those high endorphin levels. And it's actually really, really good to understand that when you have high endorphin levels, your body feel more alert, attentive, and even after birth, you're able to strengthen that relationship and that bonding moment because now you're looking at this little human, you're like, oh my gosh, you're amazing. I just had you. What is life, right? It's like that transcendent moment. And and then when we think about what happens when we don't have enough endorphins, it may contribute to the postpartum and like baby blues. So when we start talking about that next week, we'll dive more into how not having enough endorphins throughout that process as your body goes from I had all these high hormones. Remember last week we were talking about prolactin and we're talking about relaxin and we talk about progesterone. We're talking about all these different hormones. And now your pregnancy's finished. And now while you were in labor, your body's releasing oxytocin and endorphins. And then after labor finishes, your body is like you're bottomed out, right? So the only two hormones that stay for a while and linger through lactating, if you're planning on breastfeeding or chest feeding, is going to be oxytocin and it's going to be endorphins. And that happy feeling that you're going to have when you look at your baby, or that you're going to have when your baby makes their first smile, like those are the moments that you're going to we want you to hold on to and allow that endorphin to help support you through the process because it's normal for the hormones to bottom out. So, what can we do now to start to help you think through what's going to be more beneficial for you in postpartum rather than being a hindrance or being something that could make it more difficult? Are there any questions about the endorphins? Okay, we're going to keep it pushing. Okay, now we talked a little bit about the things that stimulate labor, and now we're thinking about things that prolong labor. So let's think of a scenario where well, let's think about a real life scenario because I could talk about what might have happened 300-400 years ago, but we're not there, right? Let's think about now. We live in LA, we're driving in the car, and we start feeling crampy, right? We feel that crampy pressure, like period cramps. Like, okay, let me get home. You get home, you got groceries in the car, you take the groceries out, you put everything away. And right as you start to put it away, you reach up and put the cereal up, and you get a big, strong surge. You get a big, strong tightening in your belly. And then you're like, "Ooh, oh my goodness. Okay, I was feeling crampy on my way home. Now I'm having contractions. Oh my goodness, labor might be starting." Now, if we feel like, if we're in a place like a home or an environment where we don't feel safe, if we don't feel like we have the opportunity to labor comfortably, if we feel like, we got people upstairs running around, sirens going off, we got homeless people outside. Everybody know if you live in LA, you live in a big city, those type of situations are normal. We're not thinking about what might have happened 200-300 years ago where, you got to worry about, I don't know, or maybe more than that, 400-500 years ago, you got about animals, or back when we think about the Stone Age, Ice Age, where you got to worry about threats of, tigers and all this other stuff. We're not even thinking about that. We're talking about right here. And most of the times when we think about why labor gets prolonged, it's because moms don't feel like they're adequately prepared, whether it be, I forgot to put the seat in the car, or I forgot to call the hospital, or the person that I'm going through this process with, whether it be my support person or whether it be my partner, my husband, whoever's there with me, they're not here, or what am I going to do? Or it's just fear, right? Fear of the impending pain, right? And when we are afraid, our body releases adrenaline, and that is a fight or flight hormone. So when we start to think about that, our body has to understand and receive the message from external, from outside of ourselves, that we are safe. You can tell yourself you're safe all day, but if you can't close your eyes and feel comfortable, or be able to go to the bathroom freely, or be able to eat freely, or be able to communicate your needs to the hospital and they listen to you, that adrenaline is going to come in. Okay. So when we start thinking about ways that you can design your birth plan, so then you can reduce those instances where your adrenaline or your fight or flight hormone becomes higher than the endorphins, higher than the oxytocin, that's going to be really, really helpful for you to ensure that you have a shorter labor, to ensure that you don't have a labor that just stalls out altogether, where literally you having contractions for 3-4 hours and then you stop, right? That's adrenaline coming in, right? I've noticed it with clients who have other children. So, like, say this is a second baby or a third baby, that baby who came before, while that mama is in labor with this second baby or this third baby, she's thinking, oh, I wonder if so and so is crying. I wonder if they're okay. I wonder if they're fed. Oh, I'm afraid they're not gonna want to bond with me. I'm afraid they're not gonna like baby. And this is all going through her head while she is going through labor. And although we're not fighting the tigers and the bears and the things out in our external environment that we would deem survival, right? Safety, instinctual, we're battling that internal thought process of, what are you doing? Why are you doing this? This is crazy. How did you even get in this situation, girl? We don't need this to happen, right? Like, it's the mental and the emotional aspect that we really have to rein in, because a lot of this pulls from the fears that we may have around delivery, the fears that we may have around motherhood. So when we're thinking about that, we have to be very, very, very aware. And this is where in the workbook, there's those areas to journal. And if you're not planning on getting the workbook, get you a journal, and it's going to be your pregnancy, labor, birth, postpartum journal, where you write down your fears, right? You write down what you're afraid of, because when we start to think about these things, it becomes scary, and now it's all in our head. If you write it down, then you can look at it in a couple of days and be like, oh yeah, I'm scared I'm a tear, or oh yeah, I'm scared I'm not going to be able to breastfeed, or oh yeah, I'm scared that my baby's not going to love me. Whatever is going on through your mind, we have to get that out, and we have to find support to get you help to understand how you can prevent tearing, to understand how you can support yourself for lactation if that's what you want to do. And then also just understanding how to parent. If you're not sure or you don't have good examples in your life, these will be instances in which we need to work through those things now while you're pregnant. So then when you're in labor, they're not lingering. Welcome in. I wanted to offer any options and opportunities for questions before we move forward. We just finished talking about adrenaline. Before that, we talked about endorphins and oxytocin. So I'm gonna pause the recording, and I'm gonna see if there's any more questions. Okay, and then, all right. So we were talking about this. What are ways to stimulate labor naturally? So nipple stimulation, sex, dancing, exercise, all help to elevate endorphins and oxytocin levels in our bodies. And we can use these remedies to stimulate labor and increase overall feelings of happiness while we're pregnant. So drop in the chat what your favorite song is. I'm not going to judge you. If it's Sexy Red, it's okay. I'm not gonna judge you. if it's Glorilla, I'm not gonna judge you. If whoever it is, drop who your favorite artist is, your favorite song in the chat, so that we can start to think about some music that we might want to listen to while we are in labor or while we're getting ready for our day, or if we need a pick me up, what's some music that you're listening to? All right. Because I know when I need somebody to be like, all right, girl, you the boss, you got this. The first thing that I go to is the first artist that I listen to when I'm like, okay, I'm feeling down, I want to hear some good vibes, is either Cleo Soul or Snow Allegra. And then if I'm in my, it's like I'm out here, I'm outside, we about to party, it's definitely Glow and Meg Thee Stallion. I do. I go there. And then if we're thinking about just overall like relaxation vibes, affirmation, of course, Erica Badu, Tony Jones, Jiminelle, those are all ones that I think about when I'm like, okay, I need to zen out. I need to get my mind right. So no judgment. We can be eclectic and multifaceted. And I be listening to a little bit of rock music too. So I love me some Lenny Kravitz. So, all right. I see y'all dropping in the chat. I see y'all in the chat. All right. So we're going to talk about the physiology of childbirth. Okay. So for all intents and purposes, we're going to say, yay, you made it to 40 weeks or 39 weeks. You are full term. It's time to welcome your baby. But how in the world are you going to do it? So this session is going to introduce the physiology of childbirth. Okay. And when we say physiology of childbirth, we are saying how we going to get this baby out and what parts of our body is going to support us and how can we keep from having any issues or having a lot of interventions so that we can deal with things that might come up naturally. Okay. Now, for some of us, we may have to go into the hospital to get induced. We may have to go in and receive some sort of intervention to support us through labor if we're already in labor naturally. But the goal here is to get you a base so you know what you can do at home, what you can do on your way to the hospital, what you can do while you're at the hospital if you are trying to stay away from, or if you want to delay Pitocin, or if you want to delay epidural, if that is in part of your birth plan. So let's have a little conversation. And for this one, I'm going to stop the recording so that we can talk a little bit, and then we'll pull it back up when I get back into the information. All right. So the goal of labor is going to be twofold. So we want your cervix to efface, which is thin out, and we want your cervix to open, to dilate. Excuse me. So when we think about effacement, we're thinking about how your body prepares for labor before it begins. And this is something that is very, very much tied into how active you are, how much you're moving your body throughout your pregnancy and closer to the time that you deliver, because effacement is all about the cervix going from feeling like the tip of your nose, which is kind of hard, not really squishy, to the inside of your jaw. So that's thin, it's squishy, it's soft, and that's going to help once those contractions and those surges get more intense to help allow your body to open without any resistance. So the process of effacement can take weeks or days before you feel any surges or contractions. As your cervix thins, you might experience increased discharge and mucus. This is where moms say, oh, I lost my mucus plug, or oh, I'm just feeling really like wet down there. I had to wear a panty liner, or I had to put a pad on. Or this is when you start experiencing more Braxton Hicks contractions closer to your due date. Right? So if our body is opening and getting soft just a little bit, just soft enough to maybe release a little bit of the mucus, then your uterus is basically, so the uterus is up top and then your cervix is holding everything in. So the cervix is like a rubber band, and the uterus is like the balloon that gets blown up while you're pregnant, and the rubber band is holding in all that baby, all that air, all of that. Okay. So as you start to get closer to labor, and as you start to get closer, that rubber band gets looser and looser and looser and looser. So then it's not, the balloon is still full, the baby's still in there, But as that balloon continues to grow, that pressure of baby's head, the pressure continues to allow for the cervical area, the lining, all of that tissue that's there to be stimulated. And the major thing that helps support with thinning is the release of prostaglandins. Now, prostaglandins aren't really like a hormone. They are released as a result of that internal stimulation and pressure. And what they do is they relax smooth muscle. So prostaglandins from baby's head are released when they move, when they shift, when they do a little CrossFit. Prostaglandins are released when you walk, when you do exercise, because gravity is swinging baby back and forth. Prostaglandins are released when you have sex. Prostaglandins are inside of semen. So if you are having sex with someone who has semen, allow them to finish inside of you. Those prostaglandins will be there and they will help to thin your cervix even more, so that when that process of labor starts, when that when that uterus starts to contract, that cervix is like, oh girl, we ready, we good, let's go, we thinned out. So these are all ways that our body prepares us and doesn't just start us at zero. Okay. So the levels of cervical effacement, when we're thinking about it from a clinical standpoint, doctors will say, when they do cervical checks, they'll say, okay, mom is 1 centimeter dilated. Oh, but she's 60% effaced, right? 60% thinned out, 60% squishy, right? And we want you to be, it's okay to not be 5 centimeters, right? It's okay to not be like that right when you start labor in the first few days leading up to labor. But what we do want is we want to see that thinning slowly start to creep up, right? And then as your body starts to have those contractions, more prostaglandins are going to be released. More pressure from baby's head is going to be on the cervix. More, and even if it's not baby's head, maybe it's the amniotic sac, maybe it's the fluid around baby that's pressing. So these are all ways that our body is telling us and preparing for this opening, because you can't open something that's hard. It's got to be thin, it's got to be soft, and it's got to be ready to yield. So when we think about cervical effacement, imagine you are lubricating the area that needs to open to allow baby to pass through, to make it down into your vagina and out of your body. Are there any questions about effacement? Okay. Thank you for that. And the final way to know that that something is going on in your body, even if labor hasn't really started, is if you notice your belly drop. And that's one that a lot of moms are like, oh, my belly size changed, or baby's getting low, or I just feel like they're in my pelvis. I just feel like they deep in there. Like, I don't know what's going on, but I just feel pressure. That is what we want you to feel. That is all positive, that is all good, and that is all leading you to meeting your baby sooner than later. Okay. So let's think about cervical dilation. So remember, labor is twofold: dilation, effacement. And we're not even at the pushing stage yet. Okay. So cervical dilation is the process of opening, right? So we thinned out a little bit, and now it's time for our body to increase those oxytocin levels and increase how strong these contractions and surges are. And when we think about this process, dilation can last anywhere from 72 to 24 hours before you deliver. And I put it like that, 72 to 24, because I want to be realistic with y'all. Okay. So 72 hours feels like, oh my gosh, that's such a long period of time. Oh my gosh, you're talking about 3 days. You're talking about 3 days of this? Yes, quite possibly. And it's okay. That's normal. That is within the normal limit of labor. And one of the things that we mentioned before, was that if we are not nourishing ourselves, we don't know how long labor is going to last, but we need to be nourishing ourselves and be doing things that are going to help us relax. So when we talk about the stages of labor shortly, we're going to be thinking about at what parts of labor are we going to be focusing on sleeping versus being active. active, and like resting or active, okay? And during labor, these contractions cause the cervix to change from being closed to fully dilated or open to 10 centimeters. And this is not a to scale dilation chart, but if you think about the size of a grapefruit, that's about 10 centimeters. And as we go down, these are all things that we are familiar with that we can know, okay, cool. My cervix is the size of a pea. My cervix opened up the size of a banana slice. Oh, she's an Oreo now. So you can start thinking about that and really start to internalize these things so that when your doctor says a cookie and you like, oh, child, I thought it was a donut. Not yet. You still got a little bit ways to go. Okay. So really just be mindful and think about how are you planning to breathe through and deal with the surges? Because that process is the longest part of meeting your baby. The delivery, that's a flash, but the dilation and the labor, that's going to take some time, and we have to be mindful of that and also be patient with our bodies. Are there any questions about dilation? Pretty straightforward. Okay, thank you. All right. So now we're going to get into something a little bit more technical, but it's really important that you as the birthing person understand where your baby is in your body. Okay. And that's not just about the position of baby, whether they're head down or breached or which way they're facing. I'm talking about in relation to your pelvis. Where is your baby starting versus where does your baby need to be in order to come down and out? So when while your uterus contracts, your baby is applying internal pressure to your cervix to help it open. As you dilate, your baby will move through your pelvis. The goal of understanding fetal station is to inform us on how to position the laboring body to ensure that baby can make their way down and out with ease and reduce discomfort for you. The use of counter pressure and position changes during labor aid in the process of ensuring labor does not stall out. Okay, so this is another thing, another light bulb should be going off for you all. Hey, I need to make sure that I understand that being hooked up to that monitor can make my labor stall out if I'm not able to change position. Okay, if my person who's helping me, if my doula who's helping me, if my partner, if they can apply counter pressure to help me get baby through this right side that keeps hurting every time I have a contraction, this might be the thing that makes it harder for me. Okay, so we really got to sink in. We got to have that moment with our body. We have to feel what's going on. So then we can move our body in a way to support baby making their way down. So let's talk a little bit about our pelvis. So our pelvis is a bowl that has two ways to open. Okay, the bowl can open out like this, or it can open in like this. Okay, so it can be out or it can be in. And now when our pelvis is out, like the image that you see, this is the top of the pelvis is open and baby sitting there chilling. Okay, now if you take your hands and you slide them underneath your booty, you bring your feet down on the ground, you can feel how those bones at the bottom of your pelvis, your butt bones, how they move when you bring your knees out wide. Those those bones go inward. They push into your midline. And then when you bring your knees in and make them knock, like if you're walking knock-kneed, now we feel those bones at the bottom open up and go away from your midline. So what happens to the top of the pelvis when we bring our knees in? That part closes. What happens at the bottom of the pelvis when we bring our knees out? That top part opens. Okay. Now, if we have a baby who is at a high station, which means that they are up closer to your belly button than they are to your pubic bone, we want to do exercises that are going to open the top. Okay, we want to do exercises that are going to open the top of our pelvis. We want to do exercises where we're leaning forward. This is a good time to use the birth ball, have wide knees. Okay, Now, if we have a baby that's already pretty low, but you're having contractions and maybe you've been on your side for a little while, or maybe you were laying on your back while they did a cervical exam. Now we want to do exercises that are going to close the top of your pelvis, which we are bringing, then that would mean that we bring our knees in. So then the bottom part of our pelvis, those booty bones, can be open so that baby will basically like stay in the pelvis instead of going up. Okay. They're not sliding back. They just have a large area to deal with. And if we aren't moving our body in certain positions and keeping our body in good alignment, especially during labor, our baby's like, okay, well, I'm stuck in here. I know I got to move. I know I got to make my way out. But what if I just turn my head this way? What if I just turn my head that way? The whole time that you're going through labor and you're moving your body, baby is doing this, rocking back and forth, trying to turn, trying to shimmy, trying to squeeze, trying to fit. That's why sometimes babies come with their hands in their up by their head, or they come with their shoulder up like this, or they present instead of the top of their head coming down, maybe the forehead comes in because they're coming in like this with the cervix is up here and they're just coming in with their forehead. Okay. So these are all things to consider, because when we're thinking about station and where they are, your baby has to make their way through your pelvis. So if you're feeling booty pressure and it's like, oh, my butt hurts, my tailbone hurts, something's going on, we want to do what? We want to open that area. So that means we want to bring our knees in. We want to open the bottom part of our pelvis so that baby can make their way. And maybe you rock from side to side with your knees in, or maybe you put one knee in and have one knee out and rock from side to side in like a lunge. These are all things that we want to start practicing now while you're still pregnant, so that when you're in labor, you could be like, oh yeah, I need to do this real fast. Okay, oh, that feels so much better. And then someone can press on your back, or someone can say, oh, let's get into your lunge pose. And you know exactly what to do and they can help you get there. Okay. So station is really important because your body can open. Your body knows how to open. But those bones and those tendons and those ligaments that have been holding you up and keeping baby in, they need to know it's time to yield. And we need to be doing exercises and things now to support those muscles and those tendons to release tension, so that when the time comes to allow baby to come down and out, that process will be really easy. Okay. Now, you don't need to worry yourself about the numbers. Just know that if you hear plus something, plus is positive, okay? Plus means baby's coming out, okay? If you hear minus, that means baby's up high, okay? So it's the opposite of what we would imagine. So plus means positive. Plus means that baby is passing your pubic bone and going down, out. Minus means baby's up high, okay? So you could hear -3. That means that baby is kind of like at the top of your pelvis, not really engaged as much. You can hear -2, -1. Any minus that you hear, we need to change positions. Okay. If you hear a +1, +2, okay, that's good. Let's go ahead and keep those knees in, so that we can ensure that baby doesn't move back up, or your positions aren't going to have you laying on your side, or we want to keep you on all fours, or we want to have you leaning forward so that baby will continue to give you that downward pressure to open and keep your pelvis, the lower part, your butt bones, open. Okay. So the top is fine when we hear plus. But if we hear minus, then we need to do the opposite. We need to open the top, and we need to do exercises or positions that are going to put pressure on baby to move down. So that's where we would do like a side lying position, or we would get on all fours and rock forward and back. And we'll talk more about these exercises that you can start doing in the next few slides. I know that was a lot. So are there any questions about fetal station? Did everybody feel where their butt bones were? Did you feel how your pelvis was moving while you practiced that?
Yes.
Okay, good. Awesome. Oh, let me go this Okay, so this is a more visual of what we just talked about. Okay, visual. This is the optimal position for baby. They are facing your spine. They are head down. They are ready to come out. If you look at this cervix right here, that cervix is opening beautifully. She is thin. She is ready to go. She is yield. Okay. Now, minus means that that baby's head would be back there. But look where baby is. Where do you guys think baby is? Drop it in the chat. What station is baby's head? Now, we're not looking at the top of their head. We're thinking about that bony part, because this part right here is molded. It's squeezed up because babies' heads are very squishy and malleable. We're thinking about where that baby's forehead is. Where is that baby's forehead? Drop it in the chat. Yes, yes. Awesome. -2. And the doctors might be like, oh, -1, -2. With a contraction, baby's at 0, right? Now, when we think about this, we want to imagine, okay, my baby's almost at 0. What can I do? Hip circles. You can literally you can do a little wind. That's what you need to do to help keep baby there. And maybe you do a little poke it out and tuck it in, pelvic tilts. Okay, those are going to be great exercises to do to keep baby in that position, and then also relieve any pressure you might be having in your lower back or in your butt. Okay. Now, when we think about optimal position, like we just mentioned, let's go back to this picture. This baby's in the most ideal position for delivery. Okay. Head down, facing your spine. So if we look at these images, that would be considered which of these? It would either be the upper left one that says right occiput anterior, or left occiput anterior, LOA or ROA. Okay, so the reason that this is the most optimal position is because as baby does those motions, as baby flexes their head, as baby moves and shimmies, they're not going to be able to do that to the degree at which it could be difficult for them to make their way out of your pelvis with these positions, because babies are not, go back to this picture, this baby has the opportunity to pass through. If we're looking at where the pubic bone is, this is the pubic bone right here, and these are all your uterine muscles. Baby can flex his little head around the pubic bone, and then your next contraction comes, and then that contraction squeezes him down more, and now he's sitting there. He's not sliding back. Now, if we look at these other ones, if we look at this ROP, right occipital posterior, this one here on the left hand bottom side, this baby is head down, but he's facing the right hip, the front part of the right hip. So when we think about that, it's like, okay, as that baby flexes, his little chin might get stuck on the pubic bone, or his little shoulder might end up being like this. And now this part of his head is coming in. So when we're imagining where we want our baby to be, when we're imagining and being mindful of how we're sitting, keeping baby in a down position, yes, a head down position, but also ensuring that when we sit, and I'm going to show you guys, when we sit, we want to make sure that we are sitting with our knees out wide and we're leaned forward a little bit. So if you're sitting on the couch and you want to recline back, you can put your legs up, but you need to have pillows that are going to prop you up so that you stay in a upright 90-degree angle. And the reason why that's really important is because if you lean back, guess where baby gonna do? Lean back, and then the weight of their head and their back and their butt is gonna put them in this ROP or this LOP. And if you leaning back all the time, or you just chilling, they're gonna go transverse, where they're not really facing any part of your hips or your bones. They're just facing to the right or to the left. And sometimes these babies end up being in like a cradle position, where their back is basically, instead of them being head down, they're turned like this. So if this is their head and this is their feet, instead of being like this, now they're turned and they're like in a cradle, like if you were holding them. And that's almost impossible to birth a baby that comes out like that. You have to do some major position changes. So being mindful now while you're pregnant will help the process be a lot easier once you actually go through labor, so that you don't have to worry about, oh my gosh, my baby's in a bad position. And what this feels like for you is anything other than ROA or LOA will have intense back labor pains where it feels like, because remember, if this baby was facing the opposite direction, their spine is against your spine. And now they doing all this flexing on your back. And you're like, oh my God, what is going on? This is way too intense, right? So we can do work now by being on all fours, by doing gentle stretching, by doing yoga, by walking, by having good alignment while we're sitting or while we're doing work at home or in the office, so that baby stays in this position. This is what I want you to start imagining that your baby looks like inside of you, so that you can really channel all of that and then implement those tools so that you don't have to worry about back labor and you don't have to worry about being forced or being really, really strongly recommended and suggested that you have to go through a C-section because baby's not in an optimal position. And we're not even going to talk about those babies that like to be breech, because they just be going butt first or foot first or leg first. So we're not going to channel none of that. But if you do have a breech baby, we can talk about how to get baby to turn. Okay, so I'm going to pause real quick here because so all this conversation about the hormones and the prostaglandins and dilation and effacement, we're going to bring it all together with the stages of labor. So during labor, oxytocin stimulates the muscles, like we already talked about, pressing your baby down and toward your cervix. Your baby's head presses on your cervix, and your body produces prostaglandins that help to thin out the cervix for effacement. So all those things feed into and play up on one another. As labor progresses, each contraction becomes more frequent and the dilation, until the dilation and the cervix is complete, okay? So when we think about this, it's going from closed and hard to closed and soft to open and soft and ready to yield, okay? And just giving you an overview of this, so as we go into the next part, you'll be able to start visualizing it. So right now, this birthing person here on the right-hand side, they have, they're definitely thin, they're thinning out. That area here where baby's head is not fully tight and closed, and the cervix is quite dilated. So when we start to think about this, we're gonna move through. That's the first stage, right? So the first stage, let me go back one. So the first stage is when we would say, okay, are you in early labor or are you in active labor? Okay. So right now, if we were to say or imagine what this birthing person is feeling, what are they feeling? Okay, right now they might be feeling pressure, they might be feeling cramping, they might be having some tightness, but it's not really like super intense. It's something they might be able to talk through or move through. And once it's done, they might have a break of, 10, 15 minutes between contractions. Okay. And for a lot of people who go into labor, and subsequent pregnancies also, if you've been pregnant more than once, then this process of early labor kickstarts things and makes it to where you really might not even know that you're 3 or 4 centimeters dilated, because your body is just prepared. It's like, all right, cool, we already ready, we already know what to do. For first timers, this is where we have to encourage, as your support people, myself, your mom, your dad, your partner, your best friend, your doula, whoever's going to be there for you, is going to be like, okay, how about you go take a shower and try to go to sleep during early labor, okay? Because early labor can be a few days before labor starts, like where it's like active and ramp and things are happening and they're staying like that. And when we think about the frequency of contractions, we're hoping for contractions to be 5 minutes apart, Each contraction lasting about 1 minute, and you having that 5 minutes, 1 minute long contraction for the course of an hour. So this is where early labor, you could be having contractions for every 10 minutes for 45 minutes, and then it stops for 4 hours. That's early labor. Your body's just getting ready. Your body's like starting the engine. It's getting it revved up. So when we think about it from that perspective, you don't need to worry about the birth bag or the hospital bag or none of that stuff. Just keep doing what you're doing. Do your little Target run. Go to the grocery store. Go for a walk. Take a shower. Lay down. Eat you some food. And keep doing what you're doing. Okay? Once those contractions and those surges start to stop you in your tracks, right, to the point where you can't talk to somebody while they're happening, this is when we want to start monitoring the contractions. Now, for some mamas, that's happening during early labor. What tools can we use to encourage them to relax? Let's take some deep breaths. Let's play some music. Let's get the bed ready. Let's make sure that they can get in the shower or use the toilet as a tool to support their body with being able to relax. I tell my clients all the time, if you have a bathtub or you have a shower, you got a sauna too, and you got a little steam room where you can put that birth ball in the bathtub, because the bathtub's got borders. You're not gonna roll away. You can put that birth ball in the bathtub, put that shower on, put your hands up against the back wall of the shower, and just let that water roll down your back. Right? It's so relaxing. Play some music, light a little candle. That's your early labor. Right? Just relax. You can rock from side to side on the birth ball. You can just sit on the birth ball. You can if you have a seat in the bathtub, you can sit on your seat. Just find those moments where you can relax while you're experiencing those early stages, because there's really nothing that you need to do. Your body is preparing. It's not quite ready. Okay. So that's what I tell my clients. Okay, well, you call me, you say you're having contractions, they're really intense. All right. How about this? How about you go ahead and take a shower, you eat something, you take a shower, and then I'll call you back in a couple hours. And most times I call them back in a couple hours and they're like, oh, I just had the best nap ever. I feel so good. I went to the bathroom to go pee and I saw a little bit of blood. I saw a little bit of mucus. Oh, girl, good job. Okay. What else do you need to do with your day? Oh, I got to go to Target. Okay, go to Target. FaceTime me if you need me. All right. These are the ways in which we can encourage people around us for the parts of the type of support that we need. And then also to where we don't have to feel that anxiety or that fear around labor and around when it's going to happen or when am I going to meet my baby. Your body is going to do it in good timing. Oh, that's a good question. Okay, so question is, does the water break in the early stage or the symptoms are just the cramps? No, your water could break in the early stage. It could not break at all, and your baby come out still in the waters, and it could break when you get to 6 centimeters. One of the things that I encourage is if you can do things to relax yourself, the longer you can keep your waters intact, the better it's going to be for you and for baby. So when we think about that, let's imagine we got a balloon with a baby, a balloon filled water, and then another balloon with a baby inside of it. Okay. Now the balloon that's filled water, that's your uterus. So we're squeezing the balloon each contraction. And every contraction, that baby that's in there is getting squeezed and squeezed and squeezed, but it's not like they're being squeezed. It's the water surrounding them being compressed. And it's a little uncomfortable, but it's not like, oh my gosh, this is so bad, right? Every time you have a contraction, it's normal, it's noted, and it is within the normal limits for your baby's heart rate to dip because they're being squeezed. So their heart is like, oh my goodness, what is this? Right? And then as the contraction releases, their heart rate goes back to normal. And then the next one comes, squeeze, right? Now, if we have all those waters around baby, that water is absorbing the shock of the contraction to where baby's heart rate just gonna dip a little bit. It's not gonna do nothing crazy. But if we have our waters break early, that baby is experiencing squeeze, 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 no water or a limited amount of water. And now you're going to have more of those deeper dips, which they call decelerations. And then it's going to take baby more time to recover because their heart rate dips so low after the contraction comes back. So in this early phase, breathing, relaxation, and just rest is going to keep those waters intact, and trying to breathe through, like when you feel that contraction build, you feel the wave build, you inhale and then you exhale. As you feel it peak, you let it out. And every one of those inhales and exhales, you're just allowing the rise and the fall of your chest and your belly. Chest and belly rise up, get big, and then as they come out, you're allowing it to come out. Because that's going to help keep those waters from getting compressing to the point where your water breaks. For some people, water breaks and it's like a big gush, like we see on the movies where the lady looks down and she's like, oh. But most times, it's just a little trickle. So imagine that balloon is filled up with water and it's just a little pinprick, and that little bit of water is trickling out. Now, once your water breaks, it's not like your baby's not getting any more fluid. Your body's still producing that amniotic fluid. Baby's still producing it, but it's not going to have the same amount that you would have when you started out with. So it's best, and what I've recognized and experienced in my own, as a doula and as a student midwife, it's been a lot better and a lot easier of a labor for people whose water hasn't broken in the early phase yet. Active labor around like 6-7 centimeters is where we expect to see that water break, if it does. And a lot of times in the movies, they give us the wrong story, right? They tell us like, oh yeah, your water breaks and then the baby comes. No. So we want to make sure we let that go and just know that your body's going to do it in the timing that it needs to. And if that means that you go through, 4 or 5 hours of intense contractions and then your water breaks, that's great. If you go through early labor and you get into active labor, and right when you feel that big intense one that pushes you into active labor, like, oh Lord, and the water breaks, that's okay too. But we really have to understand that for the sake of you and for baby, it's easier. And that's why that amniotic fluid is the way it is. It's preparation for baby to practice breathing. It's preparation for baby to practice digestion. It's absorbent. And during pregnancy, it's absorbing sound and the shock of walking and moving. And then in labor, it's absorbing the shock of the contractions. Okay, so that was early labor. Now we are in active labor, okay? Now, your body is opening beautifully. You were going through the contractions. Everything was good. Your body was doing what it needed to do. Active labor came and went. You made it to 10 centimeters. And now it's time to push your baby out, okay? So labor is broken up into 2 stages, or two phases. And the first phase is broken up into 2 stages. So that's why we say active or early stage, active stage. And then once we get through active, that second phase is transition. Transition is when your body is catching up to the idea of, oh my goodness, I just opened up and it's almost time for me to birth this baby. What in the world is going on? During this phase, it's normal for mamas to feel shaky. That's the hormones. That's all those prostaglandins surging and all that, all the endorphins. It's all the oxytocin. It's all the things filling your body up, and you're like, holy moly, what is going on? I'm about to birth a baby. Y'all gonna have to pull this baby out. What am I gonna do? All that mental talk, all that anxiety, all that fear comes in. It's normal for you to shake. It's normal to feel nauseous. It's normal to vomit. It's normal to get really scared and tearful. So this is where we have to, as support people, we have to stay grounded, and we have to let you know that everything you're experiencing is normal. So if you say, oh, I'm getting cold, like, okay, I'll get you a blanket. And then, because you're shaking, right? Because mentally it's like, oh, I'm shaking, I must be cold. Let me have a blanket. And then you're shaking, and then right when you put the blanket on, oh, I'm hot, take that blanket off me. Okay, let me take the blanket off. right? We're not gonna say, oh, you just told me to put the blanket on you. What you want? I want what I want in the moment. And as a birthing person, you have the right to say these things in that time. During transition, you may want everybody to leave the room. You may want everybody to be there. You may want people to put their hands on you before you get in transition while you're in active labor with the counter pressure and all the things. But then during transition, it's hands off, don't touch me, don't do nothing to me, everybody be quiet. Okay. And all of that is normal. Okay. So feel confident in your ability and know that your body knows what to do and you are almost there. Now, after transition is the pushing stage. The pushing stage begins and baby is delivered. Depending on station, remember we're talking about station, the plus being positive, minus being we got some work to do. This process could take anywhere from 20 minutes to 2 hours. So this is why when we are thinking about our birth plans, we want to put on our birth plan, I request the opportunity to labor down, which means that just because you are at 10 centimeters and just because you are fully complete and you are fully dilated and you are fully effaced does not mean that it is time to start pushing. Because out of all of this work, pushing is the most taxing thing that a mama can do if it's longer than 20 minutes. Okay. And 20 minutes looks like you probably a laboring mom, somebody who's about to deliver in 20 minutes. That's roughly, let's say maybe 7 to 10 contractions. So that means that you're pushing 30, about 28 to 30 times, because in each contraction, we want to get 3 good pushes. I don't want you to be doing that for 2 hours. Okay, so when we think about laboring down, that's getting in those positions in each contraction and being like, okay, I'm gonna rock from side to side, or I'm gonna lean forward, or I'm gonna get in the squat, or I'm gonna do cat and cow, or I'm gonna lay on my side. Like these are things that are really important so that you don't have to be pushing for a long time. And optimally, I don't want you pushing more than 5 minutes. But we got to be realistic because sometimes it takes some time to get used to it, especially if you have an epidural. So this is where that 2-hour mark can set us up, and we think, oh, pushing is going to be easy. Not if your baby's not in a good position, and not if you are not fully intact as far as your ability to feel where baby is so that you can move. So once baby's delivered, everything, you get this sigh of relief. Most moms that I talk to, they say it feels like they took the biggest poop of their life. And I know that sounds so crazy to hear me say, but that is literally what they say. So I'm gonna tell you what they said. I'll be honest with you. Because it's pressure. When you have this baby who's literally right here, that's pressure on your rectum. That's pressure of like, oh my goodness, I gotta push this out. I can't hold it anymore. That's when we want you to push. That's when we want you to bear down. That's when we want you to allow that contraction to help support you with the down and out. And after baby's born, you got a little bit more work to do. The final stage of delivery. So we went through the labor, the dilation, effacement. Now we're in the delivery. First baby is born. That's the first part of delivery. And the second stage of delivery is delivery of the placenta. And when we deliver the placenta, it normally happens, if we think about it, in a hospital setting, they're going to support you with having your placenta delivered within about 3 minutes after you deliver your baby. And this is when you can request the delayed cord clamping if that's something that you're interested in, or, banking your umbilical cord blood, whatever you want to do with that. And then in a natural setting where maybe it's like a birth center or home birth, the placenta would likely be delivered within about 30 minutes after you deliver. And it would be the same way that they do in the hospital. They tell you to take have a good little push, and they, guide it out and ensure that uterus is closing down and your body is prepared for just everything getting closed and closed and closed, and make sure no extra placenta left over to ensure that you don't have any lingering bleeding or anything like infection wise. Now, are there any questions about the stages of labor before we move into this next part? Because we're almost at time and I want to make sure that I don't skip any. All right. So You birthed your baby, you birthed your placenta, and now we are thinking about shifting gears a little bit. We were talking about counter pressure, we were talking about position changes, and I just wanted to give you an overview really quickly of what counter pressure was, and then also how important position changes and support is during labor, because this is not meant to be a one woman show, right? Like, support is really important, and counter pressure is going to be super duper 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 helpful for you as well as for your baby to ensure they stay in a good position. So, some of these images here on the right hand side are examples of counter pressure. This one at the bottom right is the pressure of somebody putting their hands on your hips while you lay on your side. And typically what I do is not just pressure, like downward pressure, but I'm rocking. I'm rocking my hands back and forth to support them during the contraction. And then when they're not having contraction, we're hands off so that your body can regulate and you won't get overstimulated. And then when the contraction comes back, we rocking. Rocking, rocking, rocking. Take some deep breaths. You're doing so good. Contraction ends, hands off. Same thing with these other ones with the birth ball. These are all good ways to apply pressure and support you through the process so that you don't just feel like, oh my goodness, this is just grueling and painful. How am I going to get through? So counter pressure is a method of non-pharmacologic pain management used during pregnancy and labor. This method consists of steady hands-on pressure to the hips, buttocks, and lower back to support the birthing person to manage the discomfort that arises as labor progresses and baby moves through the pelvis. Many women find that the use of counter pressure is most effective in early and active labor during contractions. So, when we're thinking about when to use counter pressure, I would definitely suggest using it when things start to get more intense. When you have to stop your tracks and say, "Oh, this is a hard one. This is a rough one. Oh my goodness, I feel it in my back. I feel it in my, I don't know, I feel it in my thighs." You can have support with somebody rubbing your legs or giving you pressure on your hips or supporting you with different position changes so that you can feel better. So, when we think about why support is really important during labor, like I had mentioned before, the counter pressure, you need other hands. You physically need somebody there. Another reason why support is really important is because you need motivation. You need someone to tell you that you're doing a good job. Even if you're only 3 centimeters and you've been laboring for 12 hours, you're still doing a good job. Okay. You and then also it's a bonding, right? This is like a rite of passage. This is something that most of us will only experience a few times in our lives. So having people there that are going to be encouraging, that are going to be asking you how you're feeling, telling you you're doing a good job, and reminding you to breathe, letting you know when you deviate from your birth plan and say, okay, girl, well, you said you didn't want an epidural. You sure you want to do it? And you say yes. All right, well, let's call them in. Where's the button? Let's push the button. Right? It's the unconditional support that helps alleviate that fear, that helps you be relaxed. And this is all feeding into what we talked about earlier around the hormones. We need to be comfortable. And we are social human beings and we do not like to go through pain alone. So, this is the one part in your life. This is the one aspect of being pregnant and laboring and birthing your baby that it is recommended and highly, highly helpful to have people there to help you that are competent and willing to take cues and not take offense if you tell them to do this, do that, leave me alone, touch me here. Like, gotta have thick skin, and letting them know how they can support you now can be really helpful so they can be prepared mentally and emotionally in the moment.